Hello? Okay, wonderful. Hi, everyone. If everyone would like to take a seat, let us know. If you're not finding a place, we'll just have someone from Hall Packs try to bring in more chairs. More chairs? Okay, one moment. Can someone let Hall Packs know for more chairs? Okay, great, wonderful. Okay, we will bring some more chairs in the meantime, but thank you. If folks want to make their way to the back, is everyone's bellies full? Yes. Good. Everyone's caffeinated. Yes. Okay. That's good. That's what we need. So this afternoon, we're going to go and have some sessions for our health technical program areas. And for this particular room, we're going to be focusing on one of our offices in the Global Health Bureau called the Center for Impact and Innovations. Um, I, unfortunately, don't actually work in the Office of Impact and Innovation. My colleague Ken does, and he is online with us. He was unable to make it here today. So I'll be moderating the session, but he'll be online with us to give us an overview. So Ken Simiyu is an innovation advisor with the Center for Innovation and Impact at USAID. He focuses on supporting health priorities that involve health innovation, market access, innovative finance. Ken also has extensive experience in global health and has an MPH from George Washington and a PhD from the University of Toronto. And so I am going to actually hand over the mic to Ken. He's joining us virtually. Ken, can you hear us?
Yes, I can hear you. Can you hear me? I can hear you. Can you hear me?
Oh, there you are. Hi,
Yeah.
Ken. We can
Hi.
see you. Can you hear us?
Yes, I can hear you well. Can you hear me well?
Yes, we can hear you.
Okay.
Great. Okay. Well, everyone say hi to Ken.
Hi.
Yay, you can see the room. Okay, wonderful, Ken. We'll turn the mic over to you if you want to start with your presentation first and giving us a little bit of an overview of what the Center for Impact and Innovation is at USAID.
Thanks, Nitu. And hi, everyone. Sorry, I couldn't join you. Nitu, you have the slides? Yeah, thanks. So I'm Ken Simiyu at the Center for Innovation and Impact at USAID. We are located within the Bureau for Global Health. Next slide, please. Yeah, the next slide again. The next one. We are located within the Bureau for Global Health, and our role is to support the different bureaus and offices within global health, within the Bureau. Next slide. So our work is to incubate new ideas, and to support the incubation of new ideas, we also nurture transformative ideas from infancy through impact, ensuring new approaches are co-designed and local stakeholders are involved. And an example of an area we do this is we are currently working on identifying opportunities at the nexus of climate, AI, artificial intelligence, and health. We are also supporting missions in developing local solutions. So we've worked with a mission in South Africa to come up with an innovative way to support, working with the private sector to support the continuation of electricity supply to offset load shedding. And this is mainly in health centers. Next. So in addition to that, we are working with innovators in different countries. The focus of this talk today, or the panelists will focus mainly on our work in Ghana, where we are working with the Ghana Health Services to support local innovators come up with innovative solutions for global health, mainly focused on maternal and child health. So I'll not talk more details on that, but we have panelists from the Ghana Health Services. And then we have also supported the development and creation of a Transform Health Fund, which is a $100 million investment fund that will go towards supporting innovators who are focused in global health based in Africa. Next slide. So at our center, we are also working on digital health for mainly supporting the Bureau efforts on digital health. The idea is to harmonize the digital health space across the world globally. So we are working together with partners like WHO to ensure that digital health solutions are harmonized and contribute to global health. So next slide. So this is just the different areas that we work with. The center supports both other bureaus and other missions, but also innovators. And it's in area of market access, innovative finance, digital health, and innovation. Next slide. I'll just skip this one, but in the interest of time, just go to the next slide. Yeah, so that is a few ways you can contact us. We have our website within the USAID.cii.gov, and also you can read about follow us on LinkedIn, and also read our impact statements online. Next slide. That is our team. Normally, it's about 15 people who are based in Washington, D.C. Next. So the next is what I mentioned is the Ghana Country Innovation Platform. Yes, next slide. So we have panelists who are going to discuss more about the Ghana Country Innovation Platform, but it's a collaboration between the Ghana Health Services, Grand Challenges Canada, and USAID, mainly through through CII. And what the objective, the next slide, please. The objective is to strengthen innovations that can improve health outcomes by supporting local innovators, and then generating, because this is a localization meeting, generating lessons learned about how to design innovation process that is tailored to locally defined needs, and then demonstrating the feasibility of a platform for countries to support innovations and invest in an ecosystem of informed and connected local health innovators. So I think I'll hand over to the panelists. That was just a quick summary of what CII does, but details can be found online. I think, Nitu, you can move to the panelists.
Yes, thank you, Ken. So the big takeaways that we need to know about the Center for Impact and Innovation, and that's different about them compared to the other Global Health Bureau offices, is that they really focus on trying to find and incubate those new ideas, right? Put them into practice and try to scale those approaches for health. So they're working in different ways than some of our more traditional, family planning, malaria, HIV, more traditional health sector area offices. So it's really a pleasure that we actually have some panelists here today from the Ghana Health Service. And so I want to quickly invite Chioma to come up, and she's joining us today as a panelist. Please come up. Yes, as a panelist as well as a presenter. So she's going to tell you a little bit more about the actual work in which USAID supported. Chioma serves as the management partner for AMP Health Partner, who has been embedded with the Ghana Health Service to actively contribute to the effective implementation of the country innovation platform that Ken had mentioned that their CII is supporting. Chioma has over 25 years of professional experiences spanning from nonprofit, public, and private sectors, and has served as a trusted advisor to senior health management and teams in Nigeria, Liberia, as well as Ghana, while also fulfilling her role as a board of director for an NGO in Sierra Leone. She holds a master's at Stanford for project management certification, as well as certifications in psychology and public health from the University of Essex and Johns Hopkins, and is currently pursuing her doctoral studies. Now, my question is to you: how can you manage all of this at once? Um, so let me please turn it over to you, Chiowoma. Thank you for joining us, and we're excited to learn a little bit more about the platform that you're supporting.
All right. Thank you very much. I hope it's okay if I stand, right? Thank you. Thank you so much. Thank you. I wasn't expecting to be out, but that's interesting. So that shows how important what we're about to talk about is to all of us. So thank you for coming. We are used to seeing 5 people, 10 people, maybe 20, 30, but not this large crowd. Some people stand. We appreciate you. So this afternoon, we are going to talk about Country Innovation Platform, which is a partnership that includes CII, Center for Innovation and Impact, which Ken talked about. Oh, thank you. Okay, okay. All right. So for the conversation, I'm going to zero in on like 6 things. So I'll talk about what Country Innovation Platform is. I will talk about what differentiates the project from other projects that we've managed in the past. Then I'll give a very brief overview of the CIP pilot in Ghana and talk about what we mean by localization. So when we are in country and we talk about localization, what it really means to us. Then we will talk about that localization and power shifting in practice. So what really happens and the key lessons we've learned from the country innovation platform. So that's basically what I'll talk about in the next 7 minutes. Oh, wish me luck. Okay, so first, so when we talk about country innovation platform, very simple. We have just 2 angles to it. The first part, bringing innovators. By innovators, we mean anyone with a solution. You can go ahead with the slides while I explain, because it's in so that our French-speaking participants could see that. Yes, this one. So you can just continue while I speak. So I'm presenting, then Dr. Alberta will present a video. So mine is just the presentation. So when we talk about CIP, we have the 2 parts. So we have the innovators, and then we have the solutions, the challenges. So what we are doing with this pilot is to bring in the people who have the solutions to solve the target real challenges that we're experiencing. So that's what this is about. And we are we are looking at a new way of doing this, a way that gives power to the people in country. So, and we'll define what that means, what it means to give them power. So now the question has always been, so how do we ensure that when we empower local stakeholders, that they take the center stage and lead the business and lead that particular project? So within CIP, why we see it as really being a different way of working is because of, 3 core areas that we all have in our different projects. So the area number 1 is common for all projects when the funding comes from somewhere else. So for all the projects we have, whether malaria, HIV, communicable diseases, whatever, or even innovation, the funding comes from somewhere else. So in this instance, we have 2 big funders handling this, Grand Challenges Canada and then USAID through CII. So the funding is not in country, is not in Ghana. So it's the same for all projects. But there are three distinct angles to this. So the first one is on how the problem is defined, how the people who would solve the problem are selected, and the process used in selecting them. So CIP is different because the definition of the problem was through a co-creation process where the people who are experiencing the problem were brought in to tell us specifically the way, what they want to see solved. So that is how the problem was agreed upon. So not a researcher outside Ghana, but the people, the key stakeholders who came together to choose this. Then for the eligible innovators, the process we're undertaking at the moment is utilized, also co-created. So where the eligible innovators would come from the communities that are equally experiencing the problem. Say a lot of them will come from Ghanaians or from Africans who understand this problem and could identify with it. So these are the three main things that makes CIP stand out from other projects. So now CIP, when we talk about localization and power shifting, what do we mean? In practice, to the low and medium income countries, it means like a couple of things. So number one, when we are talking about ownership, we are talking about owning the challenges, owning the solutions, and owning the process, even when you don't bring the money. So they want to be part of selecting the challenges, part of co-creating the solutions, and then part of agreeing on the process for selecting who would solve the problem. So rather than bringing someone who is overseas or who would stay in a hotel, they want to be part of it, even if they are locally based. And that's what they understand by localization. The second thing they understand about localization is when the decision making is contextually based, so when it is geographically located. So if it involves the ministry, have the ministry join the party when it is time for decision making, and not make the decision on their behalf, but allow them to make the decision themselves. And that's part of what we are doing on the CIP. Then the other thing we also hear from in countries is that they want partners to respect. Please continue with this. Okay. The slide is not moving, right? Even though so that they will see where I am. But for them, they want to, in country, they want their needs to be respected. They want their preferences to be considered. And that's what they mean by localization. So when we consider them and respect their view, even if they are not bringing the money, but they want to feel respected, because that's not what happens in some projects. In some projects, when people who bring in the money come in, they usurp your power to choose. They choose for you, they implement for you, they even select for you, and they take the decisions, only come to you to rubber stamp, to approve. But on the CIP, we are doing it a bit differently, which is considering the view of the people who feel the pinch of the problem. And then lastly, explore all ways, formal and informal ways that could make it easy for us to make decisions. So localization in practice, when we are talking about that, we really want to make sure that whoever is interested in localizing allows the people who feel the pinch of the problem or who would be part of the solution or the problem to really have a space at the table. Sometimes we create the table, but we genuinely do not want them to come in and be part of the decision making, because we bring the money. So we are saying co-create, co-create to identify the problem. We are saying co-design the process and the solutions. We are saying strengthen their leadership and management capacity to come to the same level so that they could operate as mutually beneficial partners, whoever is bringing the money. And we are saying make it iterative so that evidence could guide both parties. Okay, so that's what we are saying. And there are a couple of lessons we've learned. Actually, this is my last slide. A couple of lessons we've learned. So some of the lessons we've learned is that when we are dealing with public sector institutions, map out enough time to allow them lead, because they have their own internal bureaucracies, just like you have in your different offices. So they need time to do that. Then the other lesson we're learning, that local evidence is important. no matter how they can collect it, but encourage them to inform whatever they do using local evidence. Then human-centered co-creation process is very key so that they can co-create together with you both the solution, the challenges, and the process. And then don't assume anything. Don't ever assume. Let them tell you what localization means to them, what empowerment means to them, what innovation means to them, what exactly they are looking for. We shouldn't interpret for them because they can interpret for themselves. And then lastly, if you have someone embedded, use both formal and informal channels to make decision making quicker. Sometimes in country, you must have that face-to-face. Email does not work for all contexts, especially when you're in country. So don't rely on your emails because it works in your country and think that in country, especially in West Africa, that could work as well. So I think that's it in a nutshell. And that picture is just to show you the kind of facilities that we work in. That is a real facility. That is a road to a real facility that is benefiting from CIP. And on that note, I say medase, which means thank you.
Thank you so much, Chioma. We're gonna have a video, unfortunately, Dr. Oh, please. Here. Unfortunately, Dr. Alberta Bertiwum Nikaro could not join us today, but she did have some pre-recorded remarks. And so Dr. Alberta is the director of the Policy Planning, Monitoring, and Evaluation Division of the Ghana Health Service. Dr. Alberta is an accomplished medical doctor and distinguished public health specialist focused on epidemiology, health system strengthening, and emergency response. She has nearly 2 decades of service in Ghana's healthcare system and has impacted clinical and public health domains, contributing to protocols, guidelines, and reports in areas like TB, HIV/AIDS, adolescent health and development, and global health security. Dr. Alberta holds an MPH from the Nutt School of Medical Sciences. So we'll just play a video that she recorded from us right now.
Hello, everyone. My name is Dr. Alberta Bertiwum. I am the Director for Policy Planning, Monitoring and Evaluation Division of the Ghana Health Service. And I am here to share with you our experience with the CIP process, the Country Innovation Platform in Ghana. I shall share a few slides. Thank you very much. So the Country Innovation Platform, the Ghana pilot, is what I'm sharing with you. For Ghana Health Service, we are one of the over 22 or so agencies of the Ministry of Health. And our mission is to provide and prudently manage comprehensive and accessible quality health services for the people of Ghana in accordance with national policies of the Ministry of Health. And our main emphasis is primary health care. Our vision is a healthy population with universal access to quality health services. And we are using ICT to improve access to and then the quality of care that we provide to people in the country. Now, looking at our current situation, we are committed to achieving universal health coverage through primary health care. And one of the innovative approaches that we're using to strengthen our primary health care is the networks of practice. Now, since 1978, Ghana has been committed to achieving primary health care in all areas of the country. And we are also committed to achieving universal health coverage by the year 2030. Our primary healthcare system is a 3-tiered system, a district, sub-district, and community level. We have realized that our sub-district system is the weakest part of our primary healthcare, and therefore, everything we're doing now is to strengthen our sub-district system. And we're using a whole of government, whole of society approach, knowing very well that the solutions to our healthcare challenges do not only lie within the purview of those of us working in the health sector. And therefore, we need all hands on board to ensure that the other key determinants of health, like the social, the environmental, the political, and the economic, are also addressed as we work hand in hand to improve the health care of the people in the country. And what we're doing by the networks of practice approach is to ensure that we deliberately connect service delivery platforms, service delivery points, all health entities within limited geographic spaces together to maximize the resources that they have in terms of skills, manpower, equipment, knowledge, expertise, to improve the quality of care that we provide, as well as the access to care for the people living in communities. And also by doing that, improve the patient experience going forward. The objectives for the networks of practice are similar to the objectives for our UHC roadmap. And the first one is to have universal access to better and efficiently managed quality healthcare services. The second is reducing avoidable maternal, adolescent, and child deaths and disabilities. And the last one is to increase access to responsive clinical and public health emergency services. Now I've highlighted the second objective, which is about reducing deaths in maternal and mothers and newborns or children. And that is one of the main priorities that we chose as a country to address using the country innovation platform. So together with our innovators, other stakeholders, and in the presence of our donor partners, we chose to highlight the innovations that we can have concerning reducing deaths in mothers and newborns. Some of the challenges that we hope innovators would help us address are as shown on the screen. Poor access to quality maternal and neonatal health services, especially in remote and underserved areas, low levels of skilled birth attendance and emergency obstetric and newborn care in certain remote areas, and even sometimes in the endowed areas, I must say. Then limited availability of essential services, medical supplies and equipment, weak linkages between health facilities and areas where we can get good maternal and neonatal health services, as well as inadequate emergency transportation for maternal and neonatal health service, along with other services that need to be transferred from one point of service delivery to the other. Now, as we navigated the CIP space, looking at power shifting and localization, this is what we did with our partners. Co-creation workshops allowed us not only to decide what we think the country needed, even at the headquarters.
Sorry, we're just going to stop it a little bit just because we're running short on time, but you heard a lot about the country innovation platforms from Chinoma. So we hope you got a good overview from the director in Ghana Health Service. Right now, we would now like to sort of actually open it up to a panel discussion. So I want to invite Winifred to come and sit. Is she here? Yes, please, as well as Paulina. Yeah. And then is Dr. Shola here? Yeah, and Dr. Shola. Oh, wonderful. Okay. So let me quickly introduce the additional panelists to the stage. Winifred is a statistician with the Policy Planning and Monitoring and Evaluation Division of the Ghana Health Service, and she has a background in actuarial science, data science, health economics. She has been instrumental in really supporting the establishment of an innovation team within the Ghana Health Service, and she also contributed really to the development of both Ghana's National Telemedicine Roadmap and the National Artificial Intelligence Strategy. And she's also supporting the Ghana's Country Innovation Platform. Paulina is a senior health planner with the Policy Planning, Monitoring, and Evaluation Division of the Ghana Health Service. Before joining the Health Service, she spent over 7 years contributing to breast and esophageal cancer research and clinical audit initiatives with the National Health Service in the United Kingdom. She also holds a master and an MCS in global health and public policy from the University of Edinburgh in Scotland. And she is also finishing her master's of health economics at the University of Ghana. And we also have Dr. Shola Dele Oluwu, who is an integral member of the AMP Health Global team. She's responsible for the area in West Africa and having previously served as the management partner at CIP. With about 14 years of experience in the field, she's a health systems strengthening expert and a leadership coach based in Nigeria. Dr. Shola offers technical advisory services and thought leadership at both the country and global levels. And she holds a master's degree from the London School of Tropical Medicine and is currently pursuing a doctorate in public health. Round of applause for these wonderful ladies, very accomplished ladies joining us today. We only have about 15 minutes left for this session. So I'm going to ask one of you a question for each sort of organization first, and then we really want to open it up to the audience. And so Chioma, I really want to ask, you mentioned that you ran an innovation competition targeting local innovators. So can you tell us a little bit more about those strategies that you use really to reach innovators to apply for these grants? Because we have a lot of local partners in the rooms that might have innovations that they would like to apply for. And so how could they potentially access something like this?
Yeah, thank you. To ensure, like in the presentation we talked about, when we invite people in country to the table, to make sure that they have their chair and they have a space on that table. And it starts with the way we advertise whatever call that we intend to advertise. So we try to use local medium to advertise several of them, medium in country, in different African countries, in Ghana. Even in Ghana, we reached out to the innovation hubs just to make sure that they are giving an opportunity to compete fairly with others who are equally interested in the innovation call. And that's how we were able to reach them. And at the end of the call, we got like over 60% of them from Ghana. And then we got others from other African countries within West Africa. And then a couple of them were equally female-led cohorts, female-led innovators. So which we feel, ended up really very successfully because of the way the call was done and how we reached out to all these other groups. So that's how we did that.
Thank you. And so we sort of have a better understanding from the application side and how to set things up. Really want to ask members of the Ghana Health Service, can you tell us a little bit briefly about what type of innovations you're actually looking for in terms of the potential for impact, especially working in health? There's many different types of innovations in different sectors within health. So can you tell us a little bit more about what those types are, where within health that you're looking for the innovation, and sort of what attributes you're looking for?
Okay, thank you very much. So within the context of the CIP, we are looking at different types of innovations. We are looking at process improvement innovations, social innovations, technological innovations. All types of innovations are welcome as long as they are able to target the priority areas that we were able to identify. And so we don't have a specific category of innovations that we are looking at, that we are more interested in the impact and the problem-solving ability of that innovation. And to answer the other parts of your questions, the attributes that we are looking for in the innovations are very simple. First of all, the innovation has to be relevant, right? It's not just about how impressive the innovation is, but rather if it is able to solve the problem at the local level and the users are able to find its relevance to their issues. And we are within the CIP, that's a country innovation platform, we are looking at innovations that are targeting maternal and child health. So within the context of this pilot project, that is the area that we are looking at. Yeah, thank you.
Great. So what I'm hearing, relevant and effective. It doesn't need to be complicated, but it needs to show impact. We only have a couple of minutes left, so I really want to turn the room over to you all. I do have some other questions I can ask, but I see questions in the room. So yes, please. So
okay, thank you to the presenters. I love innovation. I think when I was looking for the rooms, I saw HIV. I was looking for TB because I'm a TB person. But the moment I saw innovation, I had to run into the room. Now, I'm looking at innovation. Thanks for the last speaker on the types, process improvement, social impact. But for us in NGO, I just want to talk more on the viability and the marketing of innovation. Now, as an NGO, we are not for profit. What then will be a driver? I'll give you, for instance, we started the TB Loan Project. First of all, I'm Dr. Bertrand Odume. I'm the Executive Director of KNCV Nigeria. We're implementing the TB Loan Project in 14 out of 36 states and FCT in Nigeria. We love innovation, and one of our key objectives is to drive innovation through research and improve impact. Now, we've actually developed a lot, but the way we are as an NGO, most times we identify a gap in our program, and we look out for some local IT companies to help solve some of those problems. Now, they develop it and they have the patent. But I will tell you, in most of those technological innovations, it's me and my team that discovered a gap in a program. We put heads together and help them to improve on those innovations. For once, we had a portable digital X-ray. It's actually deployed across the states in far remote locations. Now, when they started shooting the X-ray, they will generate the digital films. We send by emails to radiologists. You may send 10 today, tomorrow you send another 10. They may succeed in only responding to 5. You've lost 15. But we put heads together, brainstormed, and came up with a local IT firm to develop a web-based application where those radiographers in far-off fields can upload the digital X-ray, and radiologists are linked to the web. They receive the alert through an app, they will report and send results directly to those radiographers in the field, and they will link patients for treatment. But this is our ingenuity, but we got an IT company, help them to perfect the innovation, and they're running with it. But we are an NGO, we are non-profit driven. I'm just looking whether you have instances and experiences and how you can provide some needed guidance so that you can equally help us to ensure our sustainability as an organization. Thank you.
Thank you. And thank you for sharing also. I would have loved to just have a follow-up to the last person, that if perhaps you could give example of one of such, especially that has benefit to the rural area. Is either that, does it help access for pregnant women or for immunization, or is it affecting nutrition, or is helping to trace defaults or something like an example, so that we could see the process, we could see some of the outcome, we could see the scalability of it. It would be very nice. Thank you.
Okay, so who wants to take the question around sustainability? Okay, perfect.
Okay, so what you described, we haven't really started the CIP yet. So we are yet to, I think we are now doing the screening, experts review, and then we hope to start in January. So based on the lessons learned, I think we can give some feedback to the CII on how things went. And then maybe you can also learn from that. But as of now, we haven't really started anything yet. This is just early days yet. So we don't really have much experience about what you're talking about. But I don't know if Winifred and Chioma has something to add on.
Yeah, I can add something to what he said. Like part of the screening and what came up during the co-creation, someone must own the problem. And it's only when a problem surfaces that we look for solutions, right? So if we want to patent the solution, then perhaps the person who is designing the solution can work together with the person who owns the problem, and then they agree. But for us, our interest, regarding innovation is to get innovators who have the solutions, whether they learned it from other NGOs or they learned it from a hospital or they went directly to the mothers, and through their encounter with them, using what we call now the design thinking model, they were able to get real life examples that give them the insights they use in developing the solutions. What we are interested in is in just the solutions. But for all the processes, like Dr. mentioned, then for the processes on who would own it at the end, then it's something that can be worked around. But for us, even in the calls that we've had, one of the requirements is that whoever is bringing a solution must be willing to grant access to people in country. There shouldn't be any ownership, per se, because we want to use it, we want to test it, we want to make sure that it's working. There will be a lot of iterations because we are looking for the best solution for the problems identified. And the problems are really very specific. So that's the stage we are in now. And I guess for people who are interested in not owning the patent, they are the ones responding. And then back to how NGOs can benefit, the call is funded. So which means the NGO is funded to try their prototype as proof of concept or to even fail. So you're funded to fail or to pass. So if it scales through and there is viability in that particular innovation, then it's an innovation that could be considered for scalability purposes. But if it doesn't scale through, then we know that that is the history. That's really the story that every innovation usually, could tell everyone, that there are some that would fail and there are some that pass. So that's the stage we are in.
I just wanted to answer the next question on how we came up with the areas that we are targeting with the innovation. So what we did that was a bit different with this country innovation platform was a co-creation workshop that was organized. And from presentation, it was clear that we believe very much in inclusivity. We believe that right from the onset, the process of even thinking about the innovation, finding the problem, even developing a prototype to implementing and everything, all the way to when the end user gets to use it, the whole process should be inclusive. And so right from the beginning, we had a co-creation workshop which included all types of stakeholders, policymakers, funders, innovators, service providers, and community members, different stakeholders within the health system that are either going to use those innovations or influence the use of those innovations. And so through that co-creation workshop was when we came up with the 4 priority areas that we are targeting with this country innovation platform. And the first one was looking at referrals, how we are going to improve our referral system, how we are going to improve transportation for maternal and child health, how we are looking at logistics, and even improving the skills or the capacity of the health workers. So these were the 4 main areas that we're looking at improving with the innovations. Thank you.
Thank you. And so unfortunate, I have to say, but we are at time for our session. So can we please give a big round of applause to our panel here and presenters? They will be here for the next session as well. Will you be here for a little bit? Maybe till the end. But if you have additional questions, please feel free to talk directly to them, but also you can remember that you can email the CII email. We will send out to you. Again, you can go to usa.gov/CII. We're moving. This is going to be the health system strengthening session. And the next ones, ones are social behavior change, health strengthening, and then not family plan. I think family or notes, but this is the health system strengthening. So if you want to stay for health system strengthening, just stay here.